Hello everyone, welcome back to our channel Cambridge NCLEX. Today we are going to continue the next episode of questions related to nursing care to promote childbearing and women's health. Let's start with the questions. So the first question is, a biphasic anti-ovulatory medication of combined progesterone and estrogen is prescribed for a female client. What should the nurse include when teaching about this oral contraceptive? So in this question, biphasic medication of combined estrogen and progesterone prescribed for a female client. So what should nurse include in her teaching when provides instruction regarding the oral contraceptive? So first of all, if we talk about the biphasic anti-ovulatory medications, the biphasic birth control pills provides a lower ratio of estrogen and progesterone during first half of the pill cycle and a higher dose during the second half. And these biphasic birth control pills provides or deliver the small amount of estrogen each day, but the level of progesterone is increased about halfway through the pill cycles. So, according to the question, which is the important teaching instructions provided by the nurse to the client who is taking these oral contraceptives? So, let's see the options here. Here, the first option is have bi-monthly pap smear. If we talk about the option first, pap smear. Pap smear is mainly done to treat the to detect the cervical cancer, and there is no need to perform monthly pap smear. Once a year is sufficient. So this is a not important teaching related to the oral contraceptives that are provided to the client. And option second is increase the intake of calcium. So here, increasing calcium intake is not relevant to the administration of oral contraceptives. So this option is also not applied here. If we move to the option third, restrict sexual activity temporarily. So about this option, sexual activity is not restricted when one is taking oral contraceptive pills. So this option is not a valid here that include in the teaching provided by the nurse. And here the option 4 is report any irregular vaginal bleeding. If we talk about the option 4, report any irregular vaginal bleeding because these anti-ovulatory drugs suppress the menstruation and breakthrough bleeding is not expected with these biphasic drugs. In case if there is any irregular vaginal bleeding may be reported, then it should be a valid reason to inform the healthcare provider about that irregular vaginal bleeding. So it is an important teaching provided by the nurse to include their teaching about the oral contraceptive methods. And this drug is mainly given, this biphasic medication is mainly given for 21 days and menstrual flow does not occur during this time. So here the option 4 is the correct one answer that the nurse include in her teaching about the oral contraceptive pills to give the accurate instruction to the client. So here the right answer for this question is option 4, that is report any irregular vaginal bleeding. Now the second question is, the nurse is giving discharge instruction to a client who has had an aspiration abortion by suction curettage. What should the nurse be told? So in this question, the nurse giving instructions to the client during discharge who has had an aspiration abortion by suction curettage. So what instructions the mainly nurse gives to the client? So if we talk about the aspiration abortion, Aspiration abortion is a procedure that uses a vacuum source to remove an embryo or fetus through the cervix. And this aspiration abortion is mainly done to induce abortion as a treatment for incomplete or spontaneous abortion, or in many cases it is used to expel out the retained fetal and placental tissues. So, which discharge instructions should be provided by the nurse to that client who has had an aspiration abortion? So, to find the right answer of this question, let's move towards the options. Now, the option first is avoid showering for 2 days. So, option first is avoid showering for 2 days. According to the option 1, there is no need to avoid shower. The client may shower daily. So, this is not an discharge instructions provided by the nurse to the client. And the option second is tampons may be used after 1 day. So, according to the option second, no tampons should not be used for at least 3 days, or according to some protocols, it should be not be used for up to 3 weeks. So, this is also not included in a nursing teaching during the discharge of that particular client. So, this option is also invalid here. So let's move to the option number third. Sexual intercourse should be delayed for 3 weeks. If we talk about the sexual intercourse should be avoided for at least 1 week, or in some cases for up to 2 weeks. It may not be delayed for 3 weeks. So this is also not an accurate answer of this question, that discharge instruction not included. And the option 4 is report bleeding that requires a pad change every 2 hours. This option is the correct one option here, because if client has excessive bleeding, so that should be reported, because it indicates that all of the product of conception have not been evacuated. There is some problem occur in a client. So during the discharge of the client is instructed by the nurse that if she will notice any of the bleeding, or there is a need of a pad change for every 2 hours, then client will report to the healthcare provider immediately, because this can cause any problem in the client, and it may show that there is some product of conception may be retained and not been evacuated. So this is an important discharge instruction provided by the nurse to that particular client. So here the right answer of this question is option 4, that is report bleeding that requires a pad change every 2 hours. Now the next question is, a client at 10 weeks gestation elects to have an induced abortion. After receiving oral mifepristone, she returned to the clinic 2 days later to have misoprostol inserted vaginally. The nurse should tell the client to return for a follow-up visit. So if we talk about this question, in this question there is a client who has 10 weeks of gestation and she wants to induce abortion. She receives firstly mifepristone orally. After that, she returns to the clinic 2 days later to have misoprostol that inserted vaginally. So, when should the nurse schedule a follow-up visit for that particular client? So, mifepristone is used to cause abortion during early part of pregnancy. It is only used up to 10 weeks of pregnancy, that is up to 70 days of pregnancy. So, after taking this, when should the nurse schedule a follow-up visit? So, for the correct answer of this question, let's move to the options. So the option first is 4 hours after the procedure. So 4 hours after the procedure is the time that is too soon. The follow-up visit is not scheduled as early, so this is an incorrect option here. And the option second is 2 weeks after the procedure. So 2 weeks after the procedure is a very late time for the follow-up visit of that particular client. So this is also an incorrect one option here. And the option third is 4 to 8 days after the procedure. This is a best time for the follow-up visit for that particular client, because a follow-up visit after the procedure, that is 4 to 8 days after the procedure, should confirm that the abortion has occurred. So this may be considered the best time for the follow-up visit for that client. And the option 4 is 8 to 24 hours after the procedure. If we talk about the option 4, this is a too late time for the follow-up visit for that particular client. So the best time for follow-up visit after an induced abortion is 4 to 8 days after the procedure. So here the right answer will be option third, that is 4 to 8 days after the procedure. The nurse should tell the client that she will return back after 4 to 8 days of the procedure for the follow-up visit that will confirm the abortion has occurred or not. Now, the next question is, a couple indicate that they do not want any more child. The wife is scheduled for a laparoscopic bilateral tubal ligation. What should the nurse include in preoperative teaching? So in this question, there is a couple who do not want any more children. The wife is scheduled for laparoscopic bilateral tubal ligation. Bilateral means both sides, and tubal ligation means it is a surgical procedure that creates permanent contraception or sterilization in a female, and that blocks the fallopian tubes, that preventing sperms from meeting eggs or preventing pregnancy. And what should the nurse include the preoperative teaching? So what should the nurse include in the preoperative teaching after that procedure, that is bilateral tubal ligation? So here the first option is, you should stop menstruating after the surgery. If we talk about the option first, menstruation will continue because there is no trauma to the ovaries or the endocrine glands involved with reproduction. So this is not a accurate reason to include in the preoperative teaching of the nurse. So the next option is, option second is, you will need to use birth control until your follow-up visit. So according to the option second, in this method, sterility is immediate. Waiting period is not required. So this option is also not applied here. And if we talk about the option number third, that is, you will be admitted as an outpatient because you can go home the same day. So according to the option third, it will be correct option, because this procedure only takes 20 to 30 minutes to perform. The client is admitted as on outpatient basis and then goes to the home on the same days after she will recover from the anesthesia. So here it is an important information that includes in the preoperative teaching of the client, that all the procedures should be tell the client that this is a short time short time procedure about 20 to 30 minutes takes to perform this procedure, and patient will be admitted for outpatient basis, and on the same day the patient will be discharged. So this is a preoperative teaching provided by the nurse to the client. And let's move to the option 4. You can have the operation reversed should you decide to have more children. So, their microsurgery to reverse the procedure is not guaranteed or easily accomplished. So, this option is a wrong one option here. It cannot be included in the preoperative teaching of the client. So, in this, the best preoperative teaching provided by the nurse is related to the procedure. That is, it is a short time procedure and done as an outpatient basis. So here the right answer of this question is option 3rd. That is, you will be admitted. The nurse should tell the client that you will be admitted as an outpatient basis because you can go home the same day. The next question is, when teaching a client about the postcoital test to evaluate fertility, the nurse should tell the client that the best time for this test is. So, according to the question, when teaching a client about the when providing teaching to the client about the postcoital test that will help to evaluate the fertility. So, during this teaching, the nurse should tell the client that what is the best time for this test. So, if we talk about the postcoital test, the postcoital test is mainly used to assess the viability of the sperm in the cervical mucus. And this test is performed 1 to 2 days before ovulation when estrogen stimulated the cervical mucus is abundant. And this postcoital test is performed by examining the cervical mucus several hours after the intercourse, ideally around the pre-ovulatory phase of the female, and that is about 1 to 2 days before the ovulation. And the cervical mucus is smeared on a slide and examined microscopically for the presence of a furning within the mucus and for the quantitative presence of sperm and sperm motility. And this test is mainly done to determine that the female is ovulating properly, her tubes are not blocked, and the male partner semen analysis is normal. So, for that purpose, the postcoital test is performed and also to evaluate the fertility of the client. So, according to the question, what is the nurse tell the client that what is the best time for performing this postcoital test? So, let's move to the options. Here, the first option is 1 week after the ovulation. Is this test performed 1 week after the ovulation? So, according to the option first, after ovulation or 1 week after ovulation, the cervical mucus becomes thick and dry. So, the cervical mucus at this time is no longer receptive to spermatozoa. So, it is not a best time to perform the postcoital test. And the option second is immediately after the menses. So, according to the option second, after menses, cervical mucus is destructive to spermatozoa and the sperm penetration at this time. So, it is also not a best time to perform this postcoital test. And if we talk about the option number third, that is just before the next menstrual period. So, the cervical mucus at that time is not yet receptive to spermatozoa. So, this is a incorrect option here. It is not applied here because it is also not a best time to perform the postcoital test. And let's move to the option number 4. Within 1 to 2 days of presumed ovulation. So at that time, it is a best time because there is an increased estrogen level at that time, and the cervical mucus is abundant, and its quality changes in such a way as to optimize sperm survival time. So 1 to 2 days before ovulation, the cervical mucus is thin, stretchy, and the sperm can easily move through it into the uterus. So this is the best time of the postcoital test. So nurse should tell the client that during or within 1 to 2 days of presumed ovulation, means before 1 or 2 days of ovulation, it is the best time to perform the postcoital test. So here the right answer of this question is option 4, that is within 1 to 2 days of presumed ovulation. So the next question is, a tube insufflation test is done to determine whether there is a tubal obstruction. The nurse knows that infertility caused by a defect in the tube is most often related to a. So, according to the question, a tube insufflation test is done. Tube insufflation test means it is a test that is done to see the patency of the fallopian tube, and it is done by pushing the air or carbon dioxide under pressure through the cervical canal. And if tubes are patent, air reaches the peritoneal cavity. So, it is mainly done in the post menstruation period, at least 2 days after the stoppage of menstrual bleeding. So, in this question, this tube insufflation test is done to determine there is a tubal obstruction. Now, the nurses knows that infertility caused by the defect in the tube, and defect is related to which problem. So, to find out the correct one answer of this question, let's move to the options. So, here the option first is tubal injury. If we talk about the option first, if there is any injury to the tube, then this can stop a woman from getting pregnant, and this will increasing the risk of becoming pregnant in the tubes, that is like tubal pregnancy or ectopic pregnancy will be occur. And tubal injury is a possible cause here, but tubal infections are more common. This option is not applied here because it is not more common, that is related to the infertility. And the option second is past infection. If we talk about the option second, that is past infection, past infections may cause damage to the fallopian tube, and damage to the fallopian tubes from infections may be due to the adhesions and due to the tubal mucosal damage or tubal occlusion, and that interferes with the normal ovum transport. So it is a most valid cause here that past infections may cause infertility. And the option third is fibroid tumor. If we talk about the option number third, this is a benign tumor of uterus and does not affect the tube. Fibroid tumors are benign tumor of the uterus, and these mainly does not affect the tube. So this is also an incorrect one option here. And if we talk about option number 4, that is congenital anomaly. So the tubal congenital anomalies are rare, as there is a more chances of uterine anomalies. So it is a rare conditions occur that congenital anomalies occurs in the tube. Mainly congenital anomalies occur in the uterine cavity. So uterine anomalies may be seen more as compared to the tubal anomalies. So here the most accurate answer of this question is past infection. Past infection is the most leading cause of infertility. So the right answer of this question is option second, that is past infections. So this is all about today's question. For the previous episodes of the questions, you can check the channel's playlist and stay tuned for the next upcoming episodes of the questions. So thank you for watching the video.